Hello friends, let's go to the next questions. So question number 8, nurse is leading an in-service about management issues. The nurse would intervene if another nurse made which of the following statement. So in in-service sessions, one nurse is saying that it's her responsibility to ensure that the consent form has been signed and attached to the client's chart prior to the surgery. Is it a nurse's responsibility? The option number 2 is it is my responsibility to witness the signature of the client before surgery is performed. Third option is it is my responsibility to provide a detailed description of the surgery. Fourth option is it is my responsibility to answer questions that the client may have prior to surgery. So here this responsibility is given here. It's responsibility to the nurse. Some of the responsibilities is merely nurse responsibility, the other one is surgeon's responsibility. So when surgeon perform the surgery, it is merely their responsibility to tell about the surgery in detail to the patient and uh, about the surgery. If any questions the patient has to clarify, it is surgeon's responsibility. The option number 3 is not a nurse responsibility. Okay, so option it is a detailed description of the surgery to be given by the surgeon. It is okay, the nurse responsibility is getting the signature and witnessing the signature, getting the sign consent obtained before the surgery and key attaching to the into the chart. That is her responsibility. Then if patient has any concern, like something like that, she wanted to ask what I have to do the day before the surgery or what I expected after the surgery, all those things, questions, something is there about the surgery prior to the surgery, something she has, the patient has, it is nurse responsibility to clarify that. If something really related to the surgery the patient is asking, then you contact the surgeon, then let them come and explain to the patient again, then make sure that patient understood what they are discussing with, then that is your responsibility too. If the patient didn't understand anything about the surgery, it was talked in the previous session by the surgeon, if not understood, you have to let the doctor knows, the surgeon know that patient didn't understand, she may need one more session of discussion. Okay, that's your responsibility comes. And now next question is, a nurse in the outpatient clinic evaluates the Mantoux test of a client whose history indicates that she has been treated during the past year for an AIDS related infection. And the nurse should document that there was a positive reaction if there is an area of induration measuring which of the following. So you gave a Maddox test, you are going to read it. Okay, it's induration in order, it's 1 millimeter, then second is 3 millimeter, then 5 millimeter, 7 millimeter. So which one you will consider as a positive reaction for a patient who had a past year has a AIDS related infection? So because for a normal being, if no AIDS, then the reading is different. When they contract with the AIDS infections, then the reading positive it is showing less. Okay, so 1 is of course no for anybody, then 3 is no, then 5 duo, 7 is the correct answer. For the normal being, how much it is? It is 10. Okay, 10 10 millimeter induration for the normal is normal people, this considered as positive. Above 5 in AIDS patients, it is considered as positive. Okay, so that was it. Non-significant reaction 1 millimeter, 3 is a non-significant reaction, 5 is non-significant reaction, 7 correct, greater than 5 area positive for client with HIV infection and history. Okay, so the next question is, a nurse in the newborn nursery has just received a report. Which of the following infant should the nurse first? So priority of care, which one you will assess first? 2-day-old infant who is lying quietly alert with a heart rate of 185. The second child is a 1-day-old infant who is crying and has a bulging anterior fontanelles. Third option, 12 hours old infant who is being held with the respirations that are 45 breaths per minute and irregular. Fourth one is a 5 hours old infant who is sleeping and whose hands and feet are blue bilaterally. So let's see which one the nurse has to see first. Okay, the first option is correct. That is, the heart rate is 185. That is normal, no, abnormal. Okay, the nurse should first go and see that baby first. Okay, the day old infant is lying quietly alert with a heart rate of 185. Correct. Infant has a tachycardia. Normal resting rate is 120 to 160. See, the baby was quiet. Of course, the baby, if the baby was crying, maybe you can see that, okay, after the baby is settled, you can say, but the baby was, so you have to go and see each and every information is given, because it's a quiet baby. Okay, so quietly lying. So 185, baby is tachycardic. Required further investigation. The question, the option number 2, the 1-day-old baby crying. When baby cries, what happens? The intracranial pressure increases and the fontanelles bulge. That is normal. And the baby is with 45 and irregular heart rate, breathing, then that is normal, because 30 to 60 is the normal respiratory rate for the newborn. So it is, and the babies will have apneic episodes, so that is considered as normal. And 5-hour-old baby is sleeping with their hands and feet blue bilaterally, that is also normal. Okay, so this post-delivery due to peripheral circulation, you will see that acrocyanosis, that is normal in 2 to 6 hours of life. That is considered as normal. So acrocyanosis in newborns. Okay, now next one is, next question. While inserting a nasogastric tube, the nurse should use which of the following protective measures? So you are splash when you deal with the body fluids and blood and body fluids, you have to take a standard precautions. So what are things you have to use? Gloves, gown, goggles, and surgical cap. Second option is sterile gloves, mask, plastic bags, and gown. Third is gloves, gown, mask, and goggles. Fourth is double gloves, goggles, mask, and surgical cap. Here, for option number 1, surgical cap, that's not required, not recommended for the standard precaution. No. The second one is wrong, because plastic plastic bag is not required, and it is not an objective of recommendation. And the third is the correct option, gloves. You need gloves, you need a gown, you need a mask, and you need goggles. Okay, you expect splash and fluid come over your body, so protection. Then double gloves, double gloves is not recommended. Goggles is recommended, mask is recommended, and surgical cap is not recommended. So that makes the fourth option wrong. Next question. The nurse is caring for client in the outpatient clinic. Which of the following phone calls should the nurse return first? This one you have 4 phone calls received, and which one you will respond first, as which patient is at a high risk here. Now, a client with hepatitis A who states my arms and legs are itching. Second option, a client with a cast on the right leg who states I have a funny feeling in my right leg. Third is client with osteomyelitis of the spine who states I am so nauseous that I can't eat. Fourth is a client with rheumatoid arthritis who states I am having trouble sleeping. So which one is the correct option? The correct option here is option number 2. The client with the cast on right leg who states I have a funny feeling in my right leg, that is the correct option, may indicate neuromuscular compromise. Okay, require immediate assessment, maybe compartment syndrome, neuromuscular compromise, something is happening. This, if you ignore this one, if you don't take immediate assessment or action with this patient, the patient may lose some, even the leg also can become, compromised, or something may lose that leg or even. So you need an immediate attention for this client. The other, everybody needs assessment and follow up everything, but not as urgent as this case. The first one, client with hepatitis A who states my arms and legs are itching caused by accumulation of bile salts under the skin. Treat with the calamine lotion and antihistamine. So that required calamine lotion and antihistamine treatment. Third option, the client with osteomyelitis of the spine who states I am so nauseous that I can't eat, require follow-up but not highest priority. The fourth one also not highest priority, the client with rheumatoid arthritis who states I am having trouble sleeping, required assessment and not a high priority. Next question. A nursing team consists of RN, LPN, LVN and NAP. RN should care for which of the following client? A client with a chest tube who is ambulating in the hall, a client with a colostomy who require assistance with the colostomy irrigation, a client with a right-sided cerebrovascular accident who requires assistance with bathing, fourth, a client who is refusing medication to treat cancer of the colon. So the treatment refusing patient required an RN care. The client who is refusing medication to treat cancer of the colon requires the assessment skill of the RN. Okay, so they need, this patient required an RN care here. Rest all patients can be the patient who is asking for bathing, as nursing care can take care of the patient, and the colostomy irrigation can be done by an LPN because require assistance, because the client with the colostomy who require assistance with the colostomy irrigation assigned to LPN. The same here, the client with the chest tube who is ambulating in the hall also can be taken by the LPN. Okay. So next is question is, a home care nurse is visiting a client during the ectric phase of hepatitis of unknown etiology. So doesn't know which hepatitis the patient is having, but ectric phase, the yellow of the sclera, eye, all those things. So the nurse should most concern if the client made this follow up. So you are interviewing the patient and patient state you that I must not share eating utensils with my family. That's a correct option. Yeah, so she's telling she's not going to share. Okay, next in, I must use my own bathing towel. That's also correct. She can do regardless of, because you don't know which one is, which hepatitis she's having. Third is, I am glad that my husband and I can continue to have intimate relations. That's a question there. Okay. So fourth one is, I must eat small frequent feedings. Okay, that one is because the digestive system is low, little down. So yeah, than having a 3 traditional full meals, you can have small meals. That's also correct here. The intimate relationship is the patient should think about it. That is the nurse should feel a concern about that. Okay, the client with the the client sorry I am glad that my husband and I can continue to have a immediate intimate relations. Correct. Avoid sexual contact until serologic indicator return to normal. So the serology indicators return to normal, and until that they have to wait. Okay, so which one is there and what is that, the how much is the virus and everything, and after that they can have intimate relationship, but they have to wait until it comes. That is her own utensils using and towel, no towel sharing, and small meal eating, this all correct. Next question. The nurse plans for a care of a client with anemia who is reporting weakness. Which of the following tasks should the nurse assign to a nursing assistive personnel? NAP, nursing assistive personnel can listening to the client's breath sound. That is not their job. Nursing aid can't do that. Setting up the client's lunch tray, then obtaining a diet history, instructing the client how to balance rest and activity. So there is teaching moments here and taking history, assessment, all those things. So that is all nursing job. The nursing aid can do what? Setting up the client's lunch tray. So the patient is symptomatic anemia, the cardiac load can be, reduced, or the exertion on the patient can be reduced, and she can set the tray for the patient. So that's it. So setting up the client's lunch tray is the apt job for this nursing assistive personnel. Next question. Nurse is caring for client on the surgical floor and has just received a report from the previous shift. Which of the following clients should the nurse see first? So in a surgical floor, which one you have to see first after once you receive your report? The 35-year-old admitted 3 hours ago with a gunshot wound, 1.5 centimeter area of dark drainage noted on the dark drainage. Okay, so it is not fresh bleeding, it's a dark. Then 43-year-old who had a mastectomy 2 days ago, 25 ml of serous fluid noted in the Jackson Pratt drain, looks normal. That doesn't require an immediate there is no red flag there. And a 59-year-old with a collapsed lung due to an accident, no drainage noted in the previous 8 hours. And the fourth is a 62-year-old who has an abdominal perineal recession. 3 days ago, client reports chills. So here, something in new. Client is reporting chills. That means the patient is getting maybe an infection. Okay. So here, the fourth option is the correct option. So the 62-year-old who had abdominal perineal recession 3 days ago, client reports chills. Correct. As a risk of peritonitis should be assessed for further symptoms of infection. Okay. Question number 1 is the option number 1, 35 gunshot. Okay, does not indicate that acute bleeding or small amount of blood. So that's okay. You can see later. Then the next one is an 23 ml of serous fluid noted in the Jackson Pratt drain of mastectomy. That is expected. So expected outcome. Then the third one is 59-year-old with collapsed lungs due to an accident, no drainage noted in the so indicate a resolution. So this one also can be seen slowly, but first who is showing the sign of infection, chills, had to be seen first. Okay guys, so see you soon with another video. Thank you for watching.